Good Tuesday morning. It feels like a Monday, but it is, in fact, a Tuesday. And thank you for joining us all across Oakland County on great radio stations, great municipal television stations, the internet, and more. It is not a radio broadcast, not a community television broadcast. It's not a podcast or even a live stream specifically. It is that and more, all of the above, if you will. It is the Oakland County, West Bloomfield, Bloomfield Hills, Birmingham, Auburn Hills, Pontiac Megacast. Good to be with you. My name is Dave Scott. Tyler Keefe will be in studio with us in just a couple of minutes, and Erica Jones in the field on this very busy Tuesday with a lot of businesses right in our backyard finally opening up. We'll talk about that in the next couple of minutes. We're going to talk to Captain Matt DeRousse. He is Matt DeRousse, forgive me. The glasses, a little bit dirty still this morning. We'll talk to the captain, the EMS coordinator in Bloomfield Township at the fire department there. Dr. Sanford Vieder will join us, the medical director and ER trauma center physician for Beaumont Hospital. We'll find out about some of the big news. We're hearing more information that there are times when to wear your mask specifically. I'm not going to say there are times to wear and times not to wear, but there are definitely times when your mask is going to be most effective. We'll get information on that. And Dr. Debra Horner is going to be with us later on. She's with the Center for Local, State, and Urban Policy at the University of Michigan, Gerald R. Ford School of Public Policy. So we have an awful lot to get to today here in the Megacast. As I said, I am Dave Scott. He is Tyler Keefe over in his chair on the other side of the studio. We had to put a whole new camera and monitor system in our studio today, so you have to make an extra effort to social distance even more than normal because I've slid over about 3 inches.
Yeah, that's good.
And we're gonna have to get the measuring tape back out, make sure we're good here. So, hey, good to be with you today. A lot going on this day as we come off the holiday. People around the state of Michigan had an opportunity to get out and enjoy the nice weather. And based on my simple observations in northern Michigan, where I was, as you know, on Friday and Saturday and Sunday, and then yesterday here in southeastern Michigan in the beautiful weather, Tyler, people I saw were doing a great job. I know there are some areas where some beaches were awful full over the weekend, in particular yesterday, where people were getting a little bit close. But I would say for the most part, people did a really good job. And I'll tell you just a quick observation from northern Michigan. Haven't been up there, and we'll talk about why I was up there and what was going on, but just a quick observation from northern Michigan. And I was in Charlevoix. I got into the Boyne City area, was in the Petoskey area, and I even stuck my nose in a Bay Harbor real quickly. From that area, I think the biggest problem that we're going to have is getting people to come out because the numbers were not that big. Now, I saw other media reports that immediately Monday, after the governor said it was okay to open up the restaurants and the bars and retail in northern Michigan, that a lot of people booked hotel rooms. You can say that, but I didn't see it. It was not your typical Memorial weekend in northern Michigan, and even down here, it didn't seem as crowded, although I understand from talking to some people that were out on the beaches locally, they were pretty busy over the weekend.
I did see some people out on the beaches as I drove around. I was in town yesterday for some of our Memorial Day productions here at Civic Center TV and roaming around town afterward for some recreation and saw some people that were out on the lakes on Orchard Lake and were out on the beaches by like Pine Lake and so on. But not a whole lot, not as much as I would have expected to have seen on a Memorial Day weekend.
All right, so we are going to talk about that more when we have more time coming up. How is Michigan reacting so far to the openings that we've had? And that's a huge story because now as we begin to open up more businesses right here at home in our own backyard, and the restaurants and others ask for the opportunity to open. Those who have not yet opened are looking for the opportunity to open. There's going to be a measuring stick. They're going to look at, hey, how have we done so far? Did it work out okay? How's the curve? How are cases? How is how's the whole situation going? And Tyler, with that information, we will, I'm sure, decide to open or not open here in Michigan.
It is. It's going to be the key determinant is how do people respond to these openings. The openings themselves are great, and that's something that a lot of people are celebrating, and they're going to continue to celebrate, but it's the reaction from the people that's going to cause the reaction in the numbers, and the government, particularly the executive office, they are going by the numbers on this.
Well, theoretically, that's what we hope, right? We will also get firsthand evidence from right here at home. I was in the field on Friday. Today, our Erica Jones is in the field. We've sent her out to Bloomfield, Bloomfield Hills, and Keagle Harbor, Sylvan Lake, Orchard Lake area out that way. I think she's heading out toward Telegraph, and will be hitting retail establishments and maybe some of the car dealers, retail establishments. They open up today along with non-essential medical operations right here in Michigan. And we'll get to our guest, Tyler, but a moment to say a big sigh of relief, and I'm sure those businesses are happy to be opening today.
I think any business that gets the opportunity to reopen as this process goes on is going to be very happy. They've either been struggling big time or they've been struggling in some way or another throughout this process. They've been hoping for this day, and I'm sure they're going to do whatever they can to take advantage of this situation. All
right. Well, thank you very much for joining us on the Megacast 89.3 Lakes FM, 88.1 WBFH, WAHS, 89.5 Avondale Community Radio, Civic Center TV, Channel 15 in Birmingham area, Municipal Access, Channel 15 on Comcast. You can watch us on Channel 99 AT&T, and online. Easy to watch us. Two ways to watch us today. Go to the West Bloomfield Parks Facebook page. You can watch us there, or civiccentertv.com, and you can watch our live stream there. So plenty of different ways to find the broadcast today. We thank all of our partners, in particular the Greater West Bloomfield Cable Communications Commission, who operates this wonderful facility that we are broadcasting from. All right, there you go. Big sigh. I think I got it all out. Did I get all the prerequisites in? Okay. Patiently waiting, Captain Matt DeRousse is with us today. He is the EMS coordinator of the Bloomfield Township Fire Department, Captain Matt DeRousse. Let me get that right, Matt. Sorry to mispronounce your name. How are you doing today? Welcome to the Megacast.
I'm doing well. How are you?
I am fine. You see, it says DNR here. We're going to get this right. Captain Matt DeRousse. Is that close?
DeRousse.
DeRousse. I see it now. Okay. See, the guys did it right, and then I made forget it. How you doing? Happy Tuesday.
Thank you. Same to you.
So last week, I think it was last week, we didn't get a chance to say thank you to you and all the folks in Bloomfield Township, but it was EMS week, I believe, last week. So thank you to you and the other first responders in Bloomfield Township.
You are welcome, and it's a privilege to serve.
Well, it's awful kind of you. We see the numbers today, and they are moving in the right direction. Articles in our major papers today say 202 cases on Memorial Day, and I know we always have fewer because there's less testing over the holiday, but the way I read that and the other media outlets are saying that is the lowest number we have had since the end of March. That's got to be good news to you guys on the front line.
It is. It's real good news, and it's consistent to what we're seeing here in the township.
Well, I mean, that's great news, and we can go in and take a look at the Oakland County numbers and see exactly what's going on in our own area. But do you feel it, Captain? You actually feeling it in fewer calls or fewer calls related to COVID-19?
Definitely fewer calls related to COVID-19. The crews may go on one or two a day, and if it's a couple, anything more than one lately, then that's a busy COVID day for us. So there are days that we don't go on any of the runs.
Whenever the phone rings in one of our 911 centers or EMS centers, I always wonder, well, do you have to pick that up? Or are we okay?
We're good.
That's not a call comes in, it's not going to hit your phone, probably.
Correct.
Okay. Well, again, I really appreciate you joining us today. Did you, as you were taking a look at this at the very beginning, it had to be overwhelming for your staff those first couple of weeks as numbers are really beginning to spike in late March and early April. Could you talk about the challenging times that we've been through?
Yeah, it was a bit overwhelming. Fortunately, very early on, we saw this coming, and as other departments and agencies were doing, we were putting in a lot of time trying to come up with a new response plan, new policies, and we were really just doing what we thought was best practice, but we didn't have any history behind it to know if it was going to work. So we started getting the plans in place early. And then a couple of things changed the way we did things, and it got us in the right direction. And that was, we went to some early runs where the dispatchers had just started screening folks, and we didn't quite get accurate information. So the crews went in and essentially got exposed to a potential COVID patient without full PPE and precautions taken, just based on that screening information. From that point on, we just made the stance that everyone has COVID-19. We will treat them that way. We're going to respond that way. And we limited the number of crews that would interface with a patient. And that has proven to not only do well for us, but that's kind of the more common policy that most departments have adopted, at least in the area, but I would imagine throughout the country.
Captain Matt DeRousse is joining us. He is the EMS coordinator, Bloomfield Township Fire Department. Captain, thank you very much for joining us. Not only good policy for you and your crews, but it's just what the general public is now being told. Wear the mask. Think of everybody that you encounter as somebody that has COVID-19, and then you're doing everything you can to keep yourself safe and keep the people around you safe.
That's very true.
So, I mean, that's where we are right now. But, that, Captain, just, it typifies what this whole thing is all about. There's a learning experience. It takes time. We've not been through a pandemic like this since, the 1912, they say, and it takes time to figure out. I'm sure you've learned things in the process locally right there in Bloomfield Township as well.
Yes, for sure. It took us, and again, we were on the front end. We were early, we being the firefighters, and getting used to the response, getting used to the extra PPE. And then you could see as this starts to ramp up, where we were in full swing, and just watching the public, as you mentioned earlier, and still at the grocery stores, all of the workers, no masks, no real PPE for them. And the public coming in and sparsely would have masks on, to where we are now with everyone having masks. That's the only way that we're going to keep from having a resurgent, a second wave type of thing, is if we keep those masks, good hand washing, hygiene, social distancing, all of those things. We can open up our country again as long as people are responsible with that type of behavior.
Well, we certainly hope so. Captain Matt DeRousse joining us, EMS coordinator, Bloomfield Township Fire Department. We certainly hope so, and that's what this show is all about. Get local information and encourage people to do the right thing. I'll just tell you anecdotally, from traveling around the state of Michigan as I did over the weekend, and I've got a place up north, so don't send me cards and letters saying it was, what are you doing? Driving up north for the weekend. And I was working. I was out there reporting too. So, but my observations, and I think this is valuable for people here in Oakland County. Captain, in Petoskey and Traverse City and in northern Michigan, they have a far more cavalier attitude than we do down here about COVID-19. And I guess it's no big surprise they haven't had the cases that we have, but people don't wear masks. You see, maybe, a lot of people are, I don't want to chastise northern Michigan. A lot of people are doing the right thing, but I would say, by and large, anecdotally, they have a slightly more cavalier attitude up there. And down here, when I came back home, it was like, wow, yeah, I felt like I was in an area that was suffering this crisis because everybody seems to be doing the right thing. And that's, to me, the big story today, Captain, and you probably see it as well. I'm so impressed, especially as we now get into summer, and it's uncomfortable wearing a mask when it's 85 degrees outside. everywhere I go, I see people doing the right thing. How about you?
Same. And you're right. I can't expect the people that are in outside of the Metro Detroit area or in the more populated areas to feel the way that we feel. We've been hit with, some of the worst cases in the country. So we were conditioned early that it's bad and it's here and it's real. And the others up north have just been staying at home. And as you say, they just did not feel the reality of it. So they don't have the built-in precautions. They don't have those behaviors built in yet. And they may never have to. And let's hope that's the case, that the disease doesn't get up there like it did here.
Well, let's hope that. But it just wanted to reinforce that to folks after being around over the weekend and seeing what I saw. What a good job, what a good job we have done down here, and how serious everyone is. And I had to pick up a couple of groceries on Monday, and same thing. And I'm sure when Erica Jones gets out in your community, where she is heading right now, Captain Matt DeRousse, I'm sure she's going to find the same thing, that there are people with masks. So big day today. Retail opens up, car dealers open up. Any thoughts about that? Does that impact your operation at all, sir?
No, not really. We'll have more traffic out, but we're kind of seeing that gradually build anyway, which just brings its own, another set of emergencies for us. You increase the traffic when the weather gets nice and people out and a little more active, and we'll get more car accidents and those related incidents. But no, I think it's a very good thing. I anticipate having some of these stores opening the way they are. And as long as people continue to be safe and wear the masks, as you mentioned, what a good job everyone's doing. I think it's just everybody's ready for this point, and I think it's a good thing and it's timely.
Well, it is, and we all need a little summertime, and we're getting that. Let us be aware, and I'm sure you are, and we'll go out with this question, but let's keenly be aware that the virus is still out there. I mean, the virus hasn't gone anywhere. We've changed our behavior. It's out there, and if you needed any evidence, even in northern Michigan, we've been talking about it, a story about two people from outside of the state of Michigan, not from downstate, but from outside of the state of Michigan, coming to northern Michigan, and now they got contact tracing, and they've got to follow up on these two people that brought the coronavirus to Traverse City. The same can happen here. We have to be careful. Captain, do you have plans in place should we see another spike? Some people are predicting it in the fall as weather cools down.
The plan is the same plan that we have from the very beginning. We will continue to respond the way that we have in terms of our personal protection. So nothing really will change there. The only thing that we may have to make an adjustment on is we had a very large kind of intensive decon procedure for our trucks, equipment, personnel after they transported somebody to the hospital. That has been broken down and kind of now each station has their own procedure. And that's just because of the infrequency of the COVID transports now. That would have to change again and ramp back up to a more of a full production in one location if we get back to the numbers that we had seen a month or so ago.
Captain DeRousse, I appreciate you mentioning that because, people are concerned if they have some other medical condition. Now more people are going to see their doctors and head out to the hospital with other things, and we're all worried about the coronavirus, and you want to make sure that you folks, first responders and hospitals, are doing what they can to make sure that things are cleaned up, that we're going to be safe. So, and again, I'm sure that if someone is the recipient of an EMS call in Bloomfield Township and any of our communities, they don't need to worry about COVID-19 from whoever might have been in that vehicle before they were there.
Now, one of the very first things the medic does when he approaches that patient is puts a mask on them, and that in itself cuts down the risk by a tremendous amount. So once you're able to stop the airborne transmission, or at least minimize it by putting a mask on, that reduces the risk for everyone. So then once they're transported into the back of that rescue, really just a simple wipe hand wipe, disinfect of the vehicle would be probably enough, but we go way above that. So it's a very thorough process, and there's a very slim chance that there's any germ of it in that rescue for the next call.
Captain, again, thanks for your service. Thanks for joining us today, and we enjoy staying in touch with you and your colleagues around Oakland County. Keep up the great work, and we'll talk soon.
Thank you.
He is Captain Matt DeRousse, EMS Coordinator for the Bloomfield Township Fire Department here on the Megacast. Dave Scott along with Tyler Keefe. We're going to take a break. We'll be right back when we return. Mark Rubenfire joins us. He is an attorney and a partner at the Jaffe law firm, and there's only a million issues, Tyler, that we can talk to a lawyer today about COVID-19. So we'll do that in just a minute. Thanks for tuning in. It's the Megacast on Lakes FM, on the Biff on 89.5 Avondale Community Radio, Civic Center TV, Birmingham Area Municipal Television, and thank you as well to the West Bloomfield Parks and Recreation Department. They've got us on Facebook, and we are also streaming live on Civic Center TV. We'll be right back.
The Centers for Disease Control and Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Stay home, stay safe, and stop the spread. And I'll tell you what, you're doing a great job, Oakland County. You are doing an unbelievable job, and it was just clear over the weekend. And I know some people, when the weather warmed up, they were having a good time in the backyard with a barbecue and a bunch of people out at the beach. But most of the people I saw were keeping their social distancing. That would be physical distancing, right, Tyler?
Yes, physical distance.
Right. And people are doing a good job. And now with the new rule in effect that says groups of up to 10 can gather, well, that makes it a lot easier to get together and have some fun with a couple of friends.
It does. In fact, yesterday after I left the office here, I went to shoot some hoops at West Hills Middle School, just a little while away from here, about a 5-minute drive, and saw a nice group of about 6 or 7 people on a baseball field together. So
you were shooting hoops. I hope it was not like a pickup game and you were playing on your own. I don't know how you can play basketball and have anyone guard
just
you.
Shooting around.
All right.
Just shooting around.
Good. How'd you do?
Pretty bad.
Can you play horse by yourself?
You can.
Okay.
You can. You can also lose to yourself in the same way.
All right. I was just thinking, let's see, you can have groups of up to 10. I'm just thinking, let's see, then I start running out of fingers before I get to 10, Tyler.
Oh, yeah.
So I think I'm in pretty good shape. I know you got a lot of friends, though. So we are delighted now to be joined by Mark Rubenfire. He is an attorney and partner at the Jaffe law firm. And Attorney Rubenfire, thank you very much for joining us here on the Megacast. Good to have you today.
Good morning. It's good to be with you.
Well, thank you for joining us. I assume you are in a space that looks very office-like. Have you been working at home? Or are you in the office, or how's it going for you?
This is the office in my house. I've been here since March 13th, working at home. When we first started working at home, I was quite busy and seemed like I was working in the office. More recently, it's become a little bit more sparse as the real estate market has changed.
So we want to talk to you about real estate today, and let's get right to it. Just casual observation, driving around. There's a lot of businesses that clearly have not opened, and I think you just take account and you start to look and you wonder whether a lot of them are ever going to be able to open back up. How are things going in the real estate market? And let's talk specifically about commercial real estate, first of all.
Yeah, so apartment, I have clients in various different areas of the real estate world. Apartment owners, storage property owners haven't seen much change yet. People are still paying their rents. People are obviously still occupying their apartments. In fact, they're probably occupying them more often than they normally would, which is putting stress on the properties. But it's in the retail world, the shopping centers and the strip centers, where we're seeing the most difficulty, early on. And in particular, it's because obviously businesses are shut down and not operating, which makes it hard for the small businesses to pay their rent, which obviously affects the landlords.
So what are landlords doing? Let's talk about them for a minute. Clearly, people are going to have trouble paying their rent. Is there relief for landlords so they can keep making their mortgage payments during this time?
So a number of landlords have applied for, in certain cases, and got what are called PPP loans, Payment Protection Program loans, which has assisted them not only with paying their employees, but paying their rent. Hopefully some of the small businesses did the same thing, that their tenants did the same thing, which allowed them to pay their rent payments. I'm sorry, the landlords are obviously paying their mortgage payments, but the tenants are paying the rent through the PPP loan program in some cases, along with their employees. So that's been a help. But the other thing to consider for all of these landlords is modifying leases. How do they deal with their tenants in terms of the tenants need to have short-term relief while they're closed, and what the landlords need to do to be able to give that to them. We've had certain situations where tenants have asked for 6 months of relief, and our recommendation to those landlords that have gotten those requests is to not commit to anything for that long. As you probably know, the pandemic has changed things greatly, and each day there's new things that come about. And we've recommended to our clients that they only commit to short-term relief for their tenants where it's appropriate. And obviously each tenant situation is different. A grocery store or a drugstore that's continuing to operate and maybe even busier than they are quite different than the hair salon or whatever it may be that isn't able to operate and still is not able to open.
Well, hopefully today is going to be a really good day. Mark Rubenfire, attorney partner at the Jaffe law firm, and one that is working in real estate. Hopefully today will be a really good day, because today retail opens back up to some degree, and today also we're going to see the opening of the auto dealers and also opening some of the medical offices. So anyone who's made it now, hopefully they got a chance to do a little bit better. Are you hearing encouraging signs from any of your property owners out there?
Well, a lot of them have said that they're more worried about, right now the businesses are starting to reopen. We're hoping that their tenants can get back up to speed and somewhere near where they were before. And some businesses will be able to do that better than others. A lot of strip centers, malls were in trouble before the pandemic. Obviously the big box retailers and Amazon have impacted the ability of those small businesses to stay in business. So with the pandemic on top of that, and people getting more used to being able to order things online and buy things online or through pickup at a big box operation, it's become more and more difficult for the small businesses to operate. We think in some cases that at least my clients have said that they're optimistic about the tenants' ability to get open again and start operating. Right now, a lot of it is on by appointment only and by curbside, which makes things more difficult. But there is some optimism. What people are really worried about now is not necessarily this week or next, but August or September, and whether the businesses that can reopen will survive longer term.
That is the big question. and it's what we're all concerned about. The PPP money starts to go away. Some of the federal relief starts to go away. And I think a lot of businesses are just hoping, hey, can I get through June? Can I get through July? And then what's it gonna look like on the other side? So no one knows. We're all waiting, crossing our fingers, and hoping the economy is going to come back. For tenants, because I'm sure you have some clients that are tenants as well. Should tenants that have been shut down and had a hard time, is it appropriate for them to ask their landlord for some kind of relief? And where should they start?
So we've counseled both landlords and tenants on how to handle the situation. And similar to what I was saying earlier about landlords, tenants should be practical about what they're asking for. Most landlords would be required to get the permission of their lender to grant relief to a tenant. So a tenant needs to carefully evaluate what their situation is, when they think they can be reopened, and what the economic impact is. And when we've counseled tenants, we've recommended to them that they be as honest as possible with their landlords in terms of what their expectations are. A lot of landlords are interested in granting relief as long as they fully understand the impact, to the bottom line, the impact to their employees of the tenant. And some landlords have been willing to grant either complete forbearance and forgiveness of rent for a period of time, month or two. And then after that, as the tenants are starting to reopen, landlords have offered half rent in some cases, or the opportunity to backload the rent to the end of the term of the lease and not pay it currently. We've tried to get creative in those situations, but obviously, as you mentioned earlier, landlords need to be able to pay their mortgage payments. So whatever they do, they need to be able to put themselves in a situation where that isn't going to be compromised. So it's complicated. Each situation is very unique. And each tenant is very different in terms of their particular situation. And we've tried to run the gamut of different ideas, which can address both the need to get the landlord some rent if possible and give the tenant time to get reopened. Ironically, the PPP loans that everybody has touted are designed to pay employees of the tenant their compensation, and also the tenants are allowed to use it for rent. Unfortunately, some of the tenants that aren't able to reopen have had to pay their employees to stay at home, and those monies are now running out as they're now able to reopen. So it's very complicated. Long term, the landlords want the tenants to be able to be in business, so they're trying to work with them currently to get them over the hump to get back and up and operating.
Mark Rubenfire is with us. He is an attorney and partner at the Jaffe law firm. You are watching and listening to the Megacast. Dave Scott along with Tyler Keefe, and you're tuned in to Lakes FM, the Biff 89.5, Avondale Community Radio, Birmingham Municipal Access, Civic Center TV in the Lakes area, and we are live right now on the West Bloomfield Parks Facebook page and Civic Center TV.com. So we're entering the new normal. Things have changed. We've learned as a society over the past couple of months that it's okay to work at home. And for a lot of people that maybe have never worked at home in the past, they're finding it's kind of cool in some ways. Employers also are doing the Zoom meeting thing. A lot of folks are working at home. They may find some efficiencies. That could impact our office building market here in southeastern Michigan. Mark Rubenfire, any thoughts about what that market is going to look like in the next 6 months to a year?
Well, as with everything, we're in the early stages of this and nobody knows for sure, but I agree with you that this stay-at-home period where people have gotten comfortable staying at home has certainly changed the dynamic for businesses that need offices. We have a couple of clients that were actually in the office sharing business, and there's great concern about what that business will be like going forward because of the need to have people in small spaces. In terms of, for example, our law firm, when we even go back, we're going to go back in stages. And I think a lot of us will continue to work at home as much as possible. We'll have staff in our offices, but much smaller staffs. And I think long term, that means that people will tend to want to use less office space, and it will impact the office market. Everything's an unknown, though, at this point. I mean, it's hard to say exactly what level we can go to in terms of condensing office space and people spending much less time in the offices. One of the issues our firm is dealing with is we have a number of employees who have young kids at home. I'm older and don't have young kids staying in my house, but our attorneys in our office that do have had a difficult time trying to manage their kids, teaching them, monitoring their schoolwork, and then also trying to work at the same time. So we'll see. I think it will impact the market. I think there are also some people that have discovered that working at home isn't for them. And I think it will have an impact. I'm not one of those that thinks it's going to have a huge impact, because I think people will want to have some time in the office generally.
No, I mean, we all like getting into the office and mingling with others, but there certainly has been a shift, and how it all works out will be interesting. You know what I was wondering the other day, just driving around looking at all these big office buildings in Oakland County. I was just thinking, well, some of these are vacant already. We may have more vacancies. And on the other side, there's always a win. There's always a pivot. And right now, we may have a shortage of residential space as people are working at home. Maybe they need that in-home office. Maybe they want to have a little bit more living space. Could you convert a 5, 6, 7-story office building into an apartment complex? I imagine that would take some zoning and some help, but a lot of these office buildings, maybe they can be converted into residential, or is that a totally crazy idea?
Well, it's a zoning question in a lot of cases. There's limited zoning for mixed use development, and buildings aren't necessarily built in a way to accommodate plumbing wise, heating wise, converting it from office to residential. But I don't think that's too far-fetched. The idea that there's going to be excess office space going forward and some properties may need to be converted is certainly possible. I'm certainly not an expert on how you do that, but I do think maybe not necessarily in West Bloomfield, but in Birmingham, for example, the idea that some office space might be converted to residential makes complete sense to me.
All right. Mark, thank you for joining us today. We really appreciate it. Mark Rubenfire, attorney, partner, Jaffe Law Firm. Mark, before we run along, anything else you want to add that might be helpful for our listeners and viewers?
Well, the one thing I would say, obviously this is early, but if there was a similar issues in the real estate market in 2008 where there were so many issues that came about as a result of the Great Recession, I have a concern that if we have a similar downturn and recession because of the pandemic, that it might impact city services. The tax values, property values will go down, tax income will go down, and ultimately we'll have a significant strain on municipalities and their ability to pay bills. And that's a long-term concern that hopefully won't happen, but I see a lot of similarities potentially with 2008, 2009.
Well, we certainly hope we will not go through another crunch and run of massive bankruptcies and home values dwindling here in southeastern Michigan, and because it would not only have impact on the municipalities, but all the people that are suffering through it. So we'll keep our fingers crossed and hope for a V. That's all we can do, hope for a V. So, Mark, thank you very much. Good to chat with you today. We really appreciate it. Good to have you on the show, and let's keep in touch, and hopefully we can talk again soon. We're going to take a break. We'll be back. Megacast continues in WAHS 89.5 Avondale Community Radio, 88.1 The Biff, 89.3 Lakes FM, and our television outlets. We'll be right back.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Good morning and welcome back to the Megacast on 89.3 Lakes FM, 88.1 WBFH, The Biff, WAHS 89.5, Avondale Community Radio. We're in Birmingham on TV and Channel 15 on Comcast. Same thing in West Bloomfield, Keegle Harbor, Orchard Lake, and Sylvan Lake. Channel 99 on cable AT&T. All across Metro Detroit, go to Channel 99 and pick the West Bloomfield Community channels. You don't have to be in West Bloomfield. You can get it from anywhere. Go and tune in there. We would really appreciate you checking us out. CivicCenterTV.com, where many come. Tyler, our numbers on CivicCenterTV.com continue to go through the roof. A lot of people are tuning in and watching the live stream in high definition. We appreciate that. And for a couple of more minutes, the West Bloomfield Parks Facebook page. I understand we're going to be interrupted there for, what is it?
Live with Lauren.
Live with Lauren.
Live with Lauren at 11. They'll be bumping us, and we'll be moving on Facebook. We'll be moving over to Civic Center.
It's her interviews with insects are much more interesting than what we're doing.
They really are.
She does a great job. We'll have her back on the channel again. So thanks to Parks, and then we'll move over to our Facebook page at the 11 o'clock hour. So a lot of big news today. For our next guest, we're joined by Dr. Sanford Vieder. He is the medical director at Lakes Urgent Care and also chairman and medical director of the ER Trauma Center at Beaumont Hospital. Dr. Vieder, thank you very much for joining us today in the Megacast.
Good morning. How are you?
Fantastic. Good to have you with us, and appreciate you joining us. Well, it's a big day for the medical community because the governor has opened up elective procedures and opened up to lots of physicians' offices around Oakland County today. Your thoughts?
Well, it's definitely a good thing. We know that there's been a lot of care that has been sort of postponed or put off, and that's been a major concern within the medical community itself. Speaking specifically to emergency situations even, we, over the last month or so, or I would even say 2 months, we've seen a pretty steady rise of patients who are having acute symptoms like chest pain or even stroke symptoms that are not coming to the emergency department and then having bad outcomes. And, the fear that exists right now of the possibility of being exposed or contracting coronavirus has prevented some lapses in judgment. And of course, all of the emergency departments, all the urgent care centers around town are ready and able to take care of people safely. And that's an important message because I kind of described this in some other interviews. We really had sort of an emergency crisis within the pandemic itself, and that being people putting off, getting care for acute issues. So it's good to see that, obviously we're starting to get more into routine care again, particularly dentists. There's a lot of people that have cardiac disease, heart disease, and it's critically important that they have routine maintenance for their dental care because it has such a lasting impact, particularly if you have valvular heart disease or an artificial heart valve. It's really critical that those people have their biannual cleanings to make sure that that doesn't become a problem for their heart valve itself.
Yeah, no, it's as soon as I get off the air today, I'm going to call my dentist and get an appointment. It's my dentist and my hair. these two folks, they miss me, along with a couple of bartenders here and there around Metro Detroit, but we won't go into that. But no, it's good to get back, and, it's worth taking time to share the message again. I know it's been safe the whole time, but everyone we talk to, from EMS officials to physicians to administrators in hospitals that have been on the show, they all say, "Hey, look, it is safe to come in. We're separating COVID-19 patients. We're making we're doing all the right things. It's so much different now as we come into June than it was in March. You've all learned a lot, and we know how to keep people safe. They got to get in, right?"
Absolutely. I mean, there's been a lot of lessons learned. There's still a lot more to learn. And we're I don't want to give anybody the wrong impression. We're not out of this yet. I mean, we're going to be dealing with coronavirus, and this is commonly known, really until we know that we've got a good vaccine or a good treatment protocol for it. So you still want to have good judgment, excellent hand hygiene, not taking unnecessary risks. But when it comes to your overall health, there's no reason to put off that care that you would otherwise look to get. And in particular at Lakes Urgent Care, what we're doing is that we have a good screening process in place. We are able to see patients that are a little higher risk, and we separate those individuals into different treatment areas. So we've learned how to kind of segregate those individuals. So if you have a non-COVID related issue, whether it's something simple like an ankle sprain or a fall or a cut, or, even if you think it's your allergies or sinus infection, we're able to take care of you. We'll put you in a different area. We go through a screening process that allows us to segregate those individuals, and we keep people safe that way. But it's important so that you don't put off those minor things that then become larger, more significant things.
All right, Dr. Vieder, thank you for joining us. Dr. Sanford Vieder, he is chairman and medical director of the ER Trauma Center at Beaumont Hospital and medical director at Lakes Urgent Care. We appreciate you coming by today and being with us on the show. A couple of things out of the news today. First of all, over the weekend, we saw the lowest number of cases. This is new positives in the state of Michigan. Yesterday, it was 202. I was surprised to see how much testing there actually was over the holiday. Somehow people are out still getting tested, but only 202 cases reported yesterday, and this is the lowest number we've had since March. It appears that we are continuing to do well.
We are, and obviously increased testing is available. We're doing testing at both of our urgent care sites. We're even doing programs for businesses and going out and doing testing for their employees, particularly if they're in the food handling or food service industry, because we want to keep everybody else safe by trying to locate those individuals who might be asymptomatic and still have a positive test, so we can get them out, get them feeling better, get them back to work. But obviously there's more testing available. There's still a little bit of a supply chain issue when it comes to the COVID test itself, but antibody testing is readily available. And you can come by either of our urgent cares and certainly get that done if you need to or want to know if you've got antibodies to COVID. But this will be an ongoing challenge throughout the medical community, and it's important, particularly for pre-surgical things. You're ready to finally get your knee done, you get your hip replacement that you put off for a couple of months. We have opportunities where you can get tested before that is done to make sure you go into that procedure safe and have the best outcome possible.
Do you need a prescription right now in Oakland County to go out and get a test? Either one?
No, you do not need a prescription. You can go to any number of places. The Michigan Department of Health does have a website, and they list all the testing centers that are available. Off the top of my head, I don't recall what that website address is, but again, certainly in Livonia and West Bloomfield at Lakes Urgent Care, we're doing testing there. You don't need a prescription, you can come in. And I know that a lot of places are finally kind of getting up to speed and doing testing now. So it's certainly readily available around town. The one thing that might still be a little bit of a challenge again is the COVID swab test. We've heard about these nasal swabs, and it's not because of the test itself, it's because of the swabs. And they go into a special tube with special fluid in it called the viral transport media. And supply chain on those can still be a little bit tricky. It kind of peaks and troughs throughout the week. You know, we'll get several hundred of them at the beginning of the week, and then we kind of go through them, and we may get some more at the end of the week. And then, you know, so we're not seeing a steady state of supply chain, but it's definitely much better than it was even 2 weeks ago. So, and I know that other urgent cares and other physicians' offices are you know, challenged by the same thing. The antibody test, which is a blood draw, is readily available. We don't have any supply chain issues with that at all. And frankly, if you're asymptomatic and you have been, you know, isolating at home, haven't really had any exposure, the antibody test is probably more appropriate anyways. And those are readily available. And that can tell you if you've been exposed. The one challenge that we still don't really know with 100% certainty is if you have a positive antibody test, does that mean that you are sort of free and clear, that you can't get coronavirus again? We just don't know the answer to that. We think that is the case, but there hasn't been enough good scientific evidence to support that notion at this point.
All right, so you still want to be cautious if
Absolutely.
you do get the antibody test and it comes back positive. But I know a lot of people, a lot of friends who've had the test, some who had it and it didn't come back positive. They were kind of bummed out. And I said, well, no, look, that's good. Don't worry about that. Some people just want this, you know, artificial shield of immunity that, and I appreciate you reassuring us today that we, even if you do have the positive test or antibodies, that you don't know, you know, how well that's going to protect you. There's no science on that at all.
That is correct. The only thing we can certainly tell you is that if you do have a positive antibody test, that means that you were exposed at one point and you developed those antibodies. Hopefully you developed them and you weren't ill. That's even better, but it doesn't really grant you lifelong or even long-term immunity as far as we know. Again, the suggestions of the early data that's coming in is that it may indeed afford some immunity, but from a scientifically based, evidence-based medicine standpoint, we just don't have enough data yet. I suspect within another month or two, we'll have a much better idea in terms of what that really means for everybody if you do have positive antibodies.
Dr. Vieder, quick question for you, and then we won't keep you any longer. I really appreciate your time today. Dr. Sanford Vieder is with us. He is the chairman and medical director of the ER Trauma Center at Beaumont Hospital and medical director at Lakes Urgent Care, and I really appreciate you sharing the information with us today that you have. Story, I think it was in Click on Detroit. If not, it was in one of our major metropolitan online newspapers. And it said that when you're outside, especially when it's hot out, it's not quite as important to be wearing your mask. Now, the governor has said you got to wear your mask when you're inside in an enclosed building. When we're outside and we're roaming around in the general population and we're keeping our social distancing, or maybe even when we're driving in our cars, especially when we're driving in our cars, you don't want your glasses fogging up. So Is it okay to get, where can we, you know where to wear them? When you're inside at the grocery store, put the darn mask on. But where do we not have to wear them?
Well, I think that's a really good rule of thumb. You know, if you're outdoors and clearly not within any significant close distance of anybody else, there's really no reason to wear a mask. And in fact, it could be, you know, somewhat disadvantageous in terms of wearing the mask because, you know, some people even have difficulty breathing with the mask on. They find it claustrophobic, and certainly if it's hot, particularly these last couple of days, it's been significantly hotter. All of a sudden, we're thrust into summer, and so it's challenging to wear a mask. And what I always worry about with the general population wearing a mask is if they're uncomfortable with it, that means they're going to be adjusting it and moving it and touching your face. And that's really the critical issue, because if your hands are not clean and you happen to have touched something that potentially was contaminated, now you've got an increased risk of actually infecting yourself. So I think that's a really great rule of thumb. If you can maintain an appropriate social distance, 6 feet or more, outdoors, there's really no reason to wear a mask, particularly when it's hot, because we want you to keep your hands away from your face.
All right. Well, nobody wants to say that. I was glad the paper came out and said it because, we want to encourage people to wear masks, and discouraging people from wearing masks isn't a good idea, but it doesn't make sense. Don't wear your mask when you're driving, my friends. I think it's downright dangerous. And if you're going to be out and about and it's hot outside and you're not near anybody, for goodness sakes, you're not protecting anything. I think it's okay, and thank you for reaffirming that. We appreciate that.
You've got to keep in mind, the reason you wear a mask is to really try and help prevent the spread from you as a spreader of the infection, okay? It generally provides some safety and some elements of protection from you contracting it. But the real reason why we wear a mask is to keep you from spreading virus, particularly if you don't know that you've got it, okay? So again, if you're not near other people, there's no reason to wear a mask. And it is safer to definitely drive without the mask, because people are not really accustomed to doing it. It's difficult enough for us as medical professionals, and we do it all the time, that you don't want to have to wear a mask at all times. So if you're outdoors, you're not in an enclosed space, you're able to maintain social distance, there's no reason to wear it.
Yeah, and especially that mask that Aunt Lily made, that she sewed for us, and, got out the sewing machine. It doesn't have the same containment of water vapors, and you start breathing in your mask, and the mask isn't tight, gets up in your glasses, and you're all fogged out before you know it. Don't drive with your mask.
Yeah, and we don't want you driving with foggy glasses.
No,
That's not a good idea.
No, Dr. Vieder, thank you very much for being with us today. We really appreciate it.
Happy to be here. Thanks again, everybody. Be safe out there.
He is the chairman and medical director of the ER Trauma Center at Beaumont Hospital and medical director Lakes Urgent Care on Commerce Lake Road in West Bloomfield, right across the street from Commerce Township. We thank him very much for joining us here on the Megacast. We have a very busy hour coming up. You now can go see the Good Doctor and other doctors. Doctor's office is opening up today. Non-essential medical is opening. It is so great. Auto dealers, retail opening today. We're going to talk more about that in just a couple of minutes. On the streets in Oakland County is our own Erica Jones, and we'll check in with her after a quick break. This is 89.3 WBLD, Orchard Lake, West Bloomfield, Keagle Harbor, Sylvan Lake, 88.1 WBFH, Bloomfield Hills, otherwise known as the Biff, and WAHS Auburn Hills, 89.5 Avondale Community Radio. Thank you for tuning in as well on Civic Center TV, Birmingham Area Television, and all of our other outlets. We'll be back after this short break.
Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Thank you, Doc. Stay home, stay safe, save lives here in Oakland County. Save the lives of your neighbors by continuing to do what you need to do and protect all of us. Governor has extended the stay-at-home order until the 12th of June. However, now we can gather in groups of up to 10 people. Today, auto dealers open around Metro Detroit and the entire state of Michigan. Non-essential medical is opening today. Retail is opening today. We had a great weekend. A lot of people got a chance to get out and enjoy the beautiful weather. Good news is that while all this is going on, the lowest number of cases reported, COVID-19 cases reported yesterday, the total, these big, huge total numbers you see, 54,881. That's a total over the entire span of this period of testing of COVID-19. So don't freak out about those big numbers. But again, a good number, and now we just got to hopefully maintain those low numbers as we go through the rest of the summer and we don't see another spike. So out somewhere in our neighborhoods is our own ACE reporter, Erica Jones. And hi, Erica. How are you today?
Hey, I'm good. How are you?
Fantastic. Where are you?
So well, it's beautiful outside. First of all, so hot. I'm very glad I got to watch the last bit of that last interview. I was very glad to hear that I don't remember his name, doctors say that we don't need to be wearing masks when we're outside alone, because I was like suffocating with my N95 on just a minute ago. But I am at the Jeep, and there's a bunch of different dealers out here on Telegraph. I went to BMW before this, and unfortunately, I don't know if these dealerships are quite as open yet as we thought they might have been. Still very, very closed off to the public. Showrooms are not open. You can really only go in if you make an appointment. So I talked to like 5 different people at these different dealerships, and no one was willing to let me come in to show anything off. So we're in the parking lot. But yeah, like I said, it's just very much by appointment only. So you can see back here, there aren't really people in the parking lot. It's just a lot of cars. And yeah, so really, unfortunately, not as much going on as we were kind of hoping and thinking there would be.
All right. Well, it's going to take time. And, Erica, it's the same thing that I experienced when I was in northern Michigan. Even though the restaurants were open, even though retail was completely open up there, people were a little reluctant to get out. Tyler Keefe is in the studios. Tyler, you can probably help us clarify the rules. Erica is right, though. You just can't walk into an auto dealer.
Oh, no.
You need an appointment. But today was the day, isn't it?
Today is the first day. Yes, today is the first day. You can go by appointment. No more than 10 people can be inside at a given time because of the new rules stating that 10 people or fewer gatherings. But it's all by appointment. You can't just walk right in.
And I think it was the same for retail, too. I think you needed an appointment to get into retail.
So.
Is that correct?
I believe so, yes.
All right. So we'll double check. But, Erica, you're saying, again, nobody. You don't even see. Did you look in the showroom and see if there were any appointment people buying a car?
I went to the doors of a couple of showrooms, and people saw me standing out there. So they approached me. And, everyone was very nice, but it was just the same, peeking their head out the door. Sorry, you can't come in. You need an appointment. So, no. And I didn't really see many people in there either. I think it's just very, very limited. A few people at a time can make an appointment. So, no, not really much to report on that, unfortunately. It's just not too much action going on.
All right. Well, I'll tell you what. Why don't you head down the street somewhere, see if you can find a retail establishment somewhere in the area. I know you're on Telegraph Road in Bloomfield Township, I believe. But just see if you can find a retail establishment, and anyone that might be open or not. Either way, we're interested in knowing what is going on around Oakland County today, and it sure looks great outside.
Oh, it's gorgeous. Like I said, thank God I don't need to be wearing that mask right now. I'm so hot, but it's nice. We have this weather finally in Michigan.
All right, well, keep the mask with you because if you're going to interview somebody, you'll need it. But for right now, yeah, I wouldn't be wearing it either. It's if you're more than 6 feet away from people, that we've gotten the word. Dr. Vieder has confirmed it's okay.
Yes, awesome. All right, I'll check in with you guys soon.
All right, that is our own Erica Jones out there in Oakland County reporting car dealerships pretty quiet today, and all this is going to take time for people to figure out, and for all of it to ramp back up.
Yeah, it's going to take a while. It's not going to be immediate, but I'm sure we'll see soon things trickling in for something like an auto dealership. Maybe people are delaying that a little bit further along. It's not something that they absolutely need in many cases right now, but I'm sure that there are people that were interested in buying a car before this crisis and are still interested now that will maybe slowly but surely, but still in that case, will be scheduling appointments soon.
Interesting interview coming up a little bit later on this hour. We're going to talk to Dr. Debra Horner from the Center for Local, State, and Urban Policy at the University of Michigan, Gerald R. Ford School of Public Policy. And Dr. Horner, I'm sure, can talk about a wide variety of subjects, Tyler, that impact our municipalities. We got all kinds of things going on. We have the controversy over the registrations that were sent out for voters to get an absentee ballot. A lot of concerns over the funding of our municipalities if we see property values dwindling, and just in other cases, revenue sharing from the state of Michigan that also helps fund our municipalities. Those dollars are going to be off with sales tax on the decline. And then not the least of which, a lot of people have not yet responded to the census questionnaires that have come in, and we can talk a little bit about that and more coming up when we talk to Dr. Debra Horner coming up in a few minutes.
It'll definitely be an interesting conversation, and it'll be really interesting to see just how much all of these topics that you just mentioned, that we just mentioned here, actually are relating to one another and to COVID-19 similarly, and will be affecting us going forward.
All right, so the big news headlines we have today, Tyler, it of course starts with what's going on here in Metro Detroit today, and you might just want to talk briefly about the openings that became effective today.
Yeah, openings particularly for retail as well as for auto dealerships. Those are limited to 10 people at a time as per the governor's other executive order instituted last week that allowed immediate gatherings of 10 people or fewer. So because of that, all those retail and auto dealerships are putting these forward by appointment.
It's very complicated. You almost need to take like a rule book with you. Like the umpire has at a baseball game when they're a little unclear, they can just take the rule book out, and if someone has a discrepancy about a rule, you just look. You almost need. Maybe we should publish our own little rule book that people can have, because the rules keep changing so quickly. So retail opening today, non-essential medical opening today, and auto dealers opening today. There is still a stay-at-home order until the 12th of June, but 10 people can gather. How you interpret that last piece of the puzzle is complicated. I mean, I don't know, and I've not gone through the Attorney General's site, but I don't know, does that mean you can go over to your friend's house now as long as you have fewer than 10 people?
It's curious, and I'm not entirely sure either, because 10 people, you may be living with 10 people in a family home. You may be around 10 people normally.
Right, but let's say, I don't want to interrupt, but let's say you go to your friend's house. So they invite me over. There's a couple, and they got a couple of kids, and they're going to light up a barbecue, and they want me to come on over for dinner. I couldn't do that, before. But now I think under the 10-person rule, you could do that. But does that violate the stay-at-home rule?
That sounds to me like a gray area, and I'm not entirely sure about it. Maybe that will be addressed today in Governor Whitmer's press conference. She is scheduled to speak at 3 o'clock, but I'm sure that will come up, or it's going to be adjusted, like we've seen in her previous executive orders where they're issued, and then a few days later we see an update from the Attorney General with a little bit more specifics.
All right. If you have a moment today, you might want to stop by and check out our Civic Center TV coronavirus page. In fact, Tyler, it's possible the answers to our questions are right here if we would just read the page. Let's take a quick look at this story from the Detroit News, and it says, fresh from a legal victory that backs her, I got to hit this button here, backs her power, Michigan Governor Gresham Whitmer extended the controversial stay-at-home order until June 12, pushing back against critics who have called for a quicker loosening of restrictions during the pandemic. I'm just reading ahead here to see if there's anything else in here that says how we are supposed to interpret this. And I think if we go to the governor's site, we'll probably find that information in there, and that is also linked off of Civic Center TV. Some of the other headlines here, lawmaker calls on Whitmer to release COVID-19 recovery numbers daily. I didn't know that was a problem, but we're seeing an awful lot of information online on a daily basis, including the information that came across my desk this morning. 202 cases on Memorial Day. That is the lowest number since the end of March.
I think it is a fair point. We've seen the new cases. We've seen the deaths almost daily, if not periodically throughout the week. But knowing how many people are recovering, having that information more readily available also helps provide some insight to the public as far as if you do get the disease, what kind of chance do you have of surviving it?
All right, other news headlines on CivicCenterTV.com. CDC is now weighed in on the school issue, and they have their own recommendations. You can read these about what the school districts might want to be considering as they reopen. One of the things they said is keeping school buses at 25% capacity at the most, keeping desks 6 feet apart, and face coverings for all students. That would make sense. You're inside the building, just like going into a grocery store. You got to have some kind of a face covering or mask. So school districts will continue to work on that. Info now from the CDC. And then also, just a quick reminder, if you go to CivicCenterTV.com/coronavirus, you can go to the page. It's been there for almost 2 months now, and that is the coronavirus cases by zip code. And that information is continuing to decline. So just a couple of quick observations. I got a minute or two, Tyler? I think I do.
Oh, yeah.
So a couple of really quick observations. First of all, retail opening today. Erica Jones is off to a retailer. We'll check in with her again soon. But I think you need an appointment if you want to go to retail. Non-essential medical is open. Auto dealers are open. 10 people or less with an appointment. Over the weekend, a lot of folks got out, enjoyed the nice weather. I think most people that I saw were doing the right thing. I was seeing masks and people behaving themselves. I'm sure at some beaches and parks that I didn't get to, we saw that there were problems, but nothing that we have seen reported in the media or through your personal accounts and mine that indicated that we had a widespread problem. There's always going to be some isolated problems. Just a quick recap of my trip up north. So I went to Charlevoix, where I have a place, so I could legitimately go up there. And I went there Thursday night, did the report with you guys here on Friday from downtown Charlevoix at noon. Now, Memorial Weekend, Friday at noon, it's still a little bit early. There weren't a lot of people there. Went into one of the places I like to have lunch at, and the bartender there, Jody, was wearing that. You saw her on Civic Center TV, was wearing the complete PPE face shield, right?
Oh, yeah.
And then there were very few people there. And then I went back for dinner on Friday night. I wanted to see what it was like and stopped in over the weekend. They had tables out in front. Those people seemed to want to sit outside. Not that many people in. They have a dining area and then a bar. And the bar, everyone was doing great. Everyone was social distancing. And then there was this one group of guys that were in there, and I was just so, they warmed my heart. You might have seen them on TV. I don't know if I got them on camera when I was there on Friday afternoon. But these guys have been gathering there. They're all older gentlemen. I would say they were in their 70s. I was trying to keep my distance because I don't really want to be around people of that age group, even though I'm asymptomatic and I don't have any reason to believe that I have had any exposure to the coronavirus. But just out of respect for people of that age group, I kept my distance. But, Tyler, they had gone in there every week. I think it was Wednesday or Thursday. They've gone in there every week for like the last 20 years. And these guys all got together, and it was really good. Most of them were retired, and it was a really good way for them to get together and bond. And I know a lot of people do that. I have other friends who are in that age group and younger, and a lot of people that are active and still working that just like to get together and socially bond with folks, and they've not been able to do it. So these guys, the minute the place opened, they all went back and went to their favorite lunch spot and got together, and that really warmed my heart. And they were able to do that. They were sitting in the very back corner of the restaurant. All the servers were wearing masks. Everyone was leaving them alone. And it was just a really good example to me of how you can open things back up and make it work.
I think it was a perfect example, and it was a really nice story also to show that there is additional positive sides to these reopenings that are being done smart and are being done with a lot of precautions being taken. And we saw it at that restaurant. You saw it again on Friday night, and we saw it from the individuals. And so far, we're doing really well. Hopefully, we'll keep it up.
I would suggest, though, this one other observation. There seemed to be I hate to use the word cavalier because that's really not fair, but they seem to be a little bit more relaxed in northern Michigan about the whole thing. And you can understand the counties I was in have had very few cases. But there are not a lot of people walking around with masks outside, and here you do see that, right? And there were not a lot of people. I would say maybe in the grocery stores it was like 60-40, okay? But all the workers were doing everything they should, and most of the people were doing everything they should. And there were signs up, and so I don't want to characterize it unfairly. I just had the feeling that up there, they were just not taking it the same way we do down here. And then the minute I got home, I felt differently. I felt, well, I hate to say it this way because it's just what was in my mind. I thought, well, here I am. I'm in Oakland County. I'm back in the war zone. It was just a different feeling. So be careful. I really, if you have the opportunity under the governor's orders or after the 12th when she opens things up, I would suggest people be careful up there because they're just not used to it. They've not gone through what we've gone through down here. And it just seems to be a little bit different psyche up there about the coronavirus.
And I think that's something that comes with the territory also. When you have an area like Oakland County and Wayne County and the surrounding county areas here in southeastern Michigan that have been hit really hard with it, people are going to be vigilant. They're going to be worried because they know that they're surrounded by this disease in one way or another. Whereas somebody in northern Michigan, where there's been very few cases and there's not really been anything all too isolated, they're going to be a little more relaxed with it because they haven't seen how hard it hits. We saw examples of that even about a month ago or 3-4 weeks ago on the west side of the state where they had relatively low caseloads and they stopped taking things as seriously as they were initially, and they saw a spike, and then that was kind of a wake-up call. That hopefully that's not the kind of thing that's necessary for people to take this seriously, and I don't think in all honesty that it will be for people in northern Michigan. But I think the difference is when you're in an area that's so inundated with the disease versus an area where you have isolated incidents, you're going to be a little more vigilant you're going to see a little more vigilance in the high concentration areas.
All right, Tyler, well said. And, just the other thing, too, when I got back home and I went to the store, it was like it was totally different. So just wanted to share that with you. Oh, here's the other thing I was going to say. On the way up and the way back, no question, a lot of water in mid-Michigan. And I was able to see from my vantage point all the water that had collected. A lot of it now has moved downstream from Midland. But, boy, they have just had a terrible time up there. And it's going to take a long time for that area to recover it. I never thought we would see that kind of flooding in Michigan. That's the kind of thing you normally expect along the Mississippi River, one of those areas. And oh, my gosh, just a tremendous amount of water. So my very best wishes to those folks in that area. So our coronavirus headlines one more time today. Erica Jones is out in the field. We'll check in with her in just a couple of minutes because retail establishments are opening today. Non-essential medical is opening today. auto dealers are opening today, and we're going to keep an eye on all that. The governor on Friday extended the stay-at-home order until the 12th of June, but again, in the order just prior to that, she allowed gatherings of 10 people or fewer here in the state of Michigan. So how all that is reconciled is a little bit complicated. Our lowest numbers for coronavirus cases over the weekend, and they always say that the number of tests over the weekend is a lot lower, but it was 202 cases on Memorial Day, and that is one of the lowest numbers, if not the lowest number that we've seen since mid-March. So we're doing good. Obviously, everyone's keeping a really close eye on the state of Michigan to see what happens now over the next couple of weeks, but there's going to be some delays. This opening happens. It's going to take some time before we really have any idea where we are. So that is an update on all fronts. We are going to talk to Dr. Debra Horner, Center for Local, State, and Urban Policy at the University of Michigan Gerald R. Ford School of Public Policy. It's coming up in a minute. Why don't we take a quick break, and we will be back. Thank you very much for joining us. This is the Megacast, and we'll be back in a moment.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
All right, welcome back to the Megacast. Dave, Scott, Tyler, Keith. There's Tyler over there. I'm trying to squeeze over to my side of the studio, Tyler, but we've got this whole new setup over here, and it's very difficult. So I'm doing my very best. We might have to put our masks back on. We have to get the official measurement in here, make sure we're truly keeping our space. Hey, thank you for joining us on 89.3 Lakes FM, 88.1 WBFH, the BIF, WAHS. It is Avondale Community Radio. We appreciate all of our stations being here with us. And, of course, Civic Center TV, Channel 15 in the West Bloomfield, Keagle Harbor, Orchard Lake area. and Birmingham area municipal access. That's Birmingham, Bingham Farms, Beverly Hills, and Franklin. Also on Channel 15 Comcast. If you have an AT&T service at your home, go to Channel 99, and you can watch us there when you get home if you're driving around. And we are on our own Facebook page today. Have we ever used our Facebook page?
We have a few times. Yeah.
Usually we're on somebody else's, but today we're actually on the CivicCenterTV.com Facebook page and also CivicCenterTV.com. So really good to have you with us, Dave Scott, Tyler Keefe, in our Lakes FM studios, and we are going to be checking in with our next guest here in just a couple of moments. Tyler, just one more quick rundown of the headlines. All in all, good news. You know, things are opening up here in the state of Michigan again today with auto dealers opening up and the retail beginning to open up. Things are getting a little bit better. Numbers, the lowest number of deaths since March also confirmed, and our testing is abundant. It was really good to hear from Dr. Sanford Vieder, the chairman and medical director of the ER Trauma Center of Beaumont Hospital, medical director at Lakes Urgent Care, let us know that you don't absolutely need a prescription to get some testing. That's new news to me. And, I thought you had to go to your doc and have your doc say it was okay, but apparently not.
Yeah, with the scarcity of these tests slowly but surely dwindling and there being wider availability of it, we're able to test more people. And it's better to have as many people tested as you possibly can to get the full scope of understanding of how the disease is spreading, where it may be at. So being able to have that open testing availability is a huge win for us.
And it was really good earlier in the show to talk to the folks at the Bloomfield Township Fire Department and the EMS unit there and find out what an effective job they can now do at cleaning their vehicles after they transport COVID-19 patients. So really no reason to worry if you need transport. And more importantly, as doctors' offices begin to open around the state, Tyler, no need to worry if you're going into the doctor's office. A lot of people are concerned that they might want to stay home because who knows who was in there. Maybe somebody had COVID-19. I mean, the most likely place to get sick is a hospital, but they have it under control. So that would be a mistruth.
It would be. We've talked now today with Dr. Sanford Vieder from Beaumont and from Lakes Urgent Care. We talked on Friday to Dr. Jamie Tawil about this as well, and they're taking extensive measures to clean areas where COVID potential patients may be. Some offices are testing their patients outside, running the test real quick indoor in their facility and making sure that they're not positive, and if they are positive, either turning them away to an ER or telling them to go home, watch their symptoms for a little while. So there are a lot of precautions that are being taken to keep these medical facilities safe from COVID-19 as non-COVID patients become more prevalent in those facilities.
All right, Tyler, thank you very much. We are delighted now to be joined by Dr. Debra Horner, from the Center for Local, State, and Urban Policy, the University of Michigan, Gerald R. Ford School of Public Policy. Dr. Horner, thank you very much for joining us via Zoom.
Thank you for having me today.
Well,
Appreciate it.
Good to have you. Good to have a doctor when we're not talking to a medical doctor and talk about some of the other matters going on. So basically, I mean, I don't know how you get all that on a business card. Center for Local, State, and Urban Policy, University of Michigan, Gerald R. Ford School of Public Policy. You call it Close-Up, is that right?
Cute little acronyms, that helps us, our little close-up acronym.
I like that. So basically, you are an expert and you study things that are going on in our municipalities. Is that broadly what you do?
That's right. So the research center where I am at the Ford School is a small research center, and we focus on state and local government issues nationwide, but we really have a strong focus on Michigan and what's going on here. Both in counties, townships, villages, and cities across the state.
And you are the research project manager at that fine institution. Is there something new that started, new research projects that have started up since this whole COVID-19 matter has reared its ugly head?
We do. The Ford School in general, and then my research center in particular, have been scrambling over the past couple months to try to produce a lot of different resources for communities across the state to be able to access and refer to when they're trying to deal with the emergency. We have in other research centers, we have the Poverty Solutions Center at the Ford School, who's doing a lot of work on what to do with helping low-income residents across the state. We've got people in a youth policy lab doing other kinds of work. And then at the center, the Close-Up Center, we're putting together a whole series of fiscal health resources for local governments across the state that talk about how to manage the fiscal crisis that's happening because of the economic shutdown related to the pandemic. So all kinds of things about debt and debt management and dealing with budget shortfalls and how to collect property taxes in an era of COVID, things like that. So those are all available to local governments, and we're reaching out to governments across the state to provide those to them, to help give them some resources to deal with what is absolutely unprecedented, right?
Well, it is unprecedented. And, you know, for you and I, this is like spicy stuff. I'm loving every moment of it, talking about, you know, budgets and debt for our townships and municipalities. I understand that that's not everybody's cup of tea, but, you know, here we are a municipal television channel, so this is a lot of what we ultimately do here is report on our local municipalities. Back to the resource side for the municipalities, going to be a double whammy. People, I think some of them are aware that the revenue for your local community is derived from property tax dollars and then from revenue sharing from the state of Michigan. So the property tax is related to your ability to pay your local tax and your property values, and the revenue sharing, I assume most of that, Dr. Horner, comes from sales tax and other state revenues, correct?
That's right. And the state has realized, they just did a new budget conference meeting earlier this month, talking about predicted shortfalls in what they thought was going to be revenue coming into the state that is then shared back out to local governments, and severe billions of dollars of shortfall that we're going to be looking at how to deal with. Unfortunately, over the past decade, since even before the Great Recession in 2008 and 2009, state revenue sharing for local governments across the state has actually declined. So the state has been able to continue to balance their budget by giving, not in total part, but in part by giving local governments less of that statutory revenue sharing that comes from out of the sales tax and is seeded back out to them. So local governments have lost, over the past decade, billions of dollars of support from the state to run their own local programs like public safety and roads. And so now that we're seeing, local governments have kind of spent the last decade climbing out of the hole from the Great Recession, slowly but surely, making themselves more solvent and solving their problems by doing more with less. And so now taking this hit is going to be a real challenge for them.
So let's talk a little bit more about one other challenge, just so people understand the whole picture. The federal government keeps coming up with all this money. You see it in the news, trillion here, trillion there, PPP program, this, money there. But the federal government can operate at a deficit. State of Michigan cannot operate at a deficit, and neither can our local communities. And I don't think people, all of the people who don't really get into this and live with this every day, really understand that. So that presents a big challenge. States, the property or the sales tax numbers are going to be way down. Fuel tax, all the other money the state's collecting. So they're not going to have the money to dish out. Schools have already been told to expect a lot less money this year, and the municipalities will. So what kind of vehicles can a municipality, you alluded to this earlier, what kind of vehicles can a municipality use to deal with some of this budget crisis? Is there any way they can borrow money or move dollars around at all? How does that work?
They can. There's a number of different approaches that they can use to try to get through this. Fortunately, there is some movement at the federal level to now address this problem for local governments at the smaller scale. So in the original CARES Act, it's my understanding, this is actually not my exact area of expertise, but I will tell you that I believe the original CARES Act, the federal government from several weeks ago, provided money for our largest municipalities, not in Michigan necessarily, although I believe Detroit was included, but big urban areas did get some money out of that. But few counties or smaller local governments had any federal money available. They are now in the current bill going through Congress negotiating whether they're going to be able to provide some additional help for local governments. And so I know that here in Michigan, the Treasury Department and the Michigan Municipal League, the Michigan Association of Counties, Michigan Township Association, some of these other associations that help local governments manage the politics of it all, are working very hard at the federal level to make some of that relief money available. Then in addition, there's some relief money available to local governments through FEMA. FEMA has put out some emergency relief funds. Unfortunately, it's funding that really is just based on dealing with COVID effects. So potentially public safety issues and things like that, not necessarily shortfall in your general revenue budget. And so it's a limited source of relief, but it does exist out there. And then the Department of Treasury here in Michigan is doing what they can to try to line up some different sources of funding, be they kind of grouped debt availability to kind of carry over local governments through the crisis. One of the things that a different group within the University of Michigan, the RSQE, which of course I'm going to get their acronym wrong, but it's a group of economists who do economic forecasting for both federal and Michigan economies. They're predicting hopefully a V-shaped recovery, which means we'll have this terrible damage to our economies and to employment, but that hopefully once we restart the economy, that might bounce back. If that's the case, local governments are somewhat fortunate in that the hit to property taxes may rebound quickly as well. The effects of bad economies tend to lag in local government revenues. They have the revenues they need to spend this year, and it's really looking at the additional expenditures from COVID and then looking ahead to next year, whether there's going to be continued economic pain. That's when you start to get nervous. So I think that's what, when I hear from local government officials across the state, that's what I hear is they're hurting now from trying to help people who are out of work, help people who need additional medical and public safety assistance. But really what they're doing is looking ahead to whether this is going to be a long-term or a short-term economic recession.
Yeah, and we like to say in the show, it was a quote that came from one of our brilliant superintendents right here in our area. It happened to be Pat Watson at Bloomfield Hills. I credit him for this. And every time he uses words, hope is not a plan. Hope is not a plan, and that is very true. And so our municipalities, I mean, they have their hands full getting ready. We were right there in the boardroom in a couple communities getting ready just to, deal with the health issues surrounding the pandemic. And now they may have an equally difficult challenge dealing with the financial impact of all this. There was, just to follow up on your comments of a couple of minutes ago, we did see some federal money pour into Oakland County and Macomb County, hundreds of millions of dollars. And that sounds like a big number, but by the time you distribute that to the county and the programs they need, and they were able to share some of that money with Oakland County municipalities, but it doesn't really go a long way. And they also elected to share some of that money with Oakland County businesses. But we have more than $100 million problem, or $200 or $300 million problem. Dr. Horner, I wasn't going to ask this, but I might as well. Do you have any idea of the scope of the problem facing municipalities around the state of Michigan? Is that something you're trying to figure out right now?
I think we're just so unsure about how this is all rolling out from week to week, and the effects on being able to open back up, being able to staff their offices, being able to assist their local hospitals, where the additional cases might occur. Right now, Southeast Michigan is obviously a municipal hotspot in dealing with illness, but will that spread to the rest of the state? It's unclear. So I think there's just so many unknowns with that one of the things that I hope is that the state and the state agencies and these some of our other municipal leaders can come together and not isolate different communities, but work as a whole, not make every community reinvent the wheel, but share resources, share ideas, share best practices with each other, so that small townships or small villages or small cities across the state aren't at loose ends and not knowing what to do and how to deal with their problems. We're all in the same boat. The larger places are struggling with some kinds of problems that are different from smaller places, but at the same time, we have a really strong network of townships, cities, and villages, and then of course counties that I think we can all work together, and that would be really helpful in helping everyone weather the crisis, as opposed to kind of just having everybody go it alone.
It will. All right, let's get off this money thing. It's a little depressing anyway. There's a lot of other issues we can talk about. She's Dr. Debra Horner from the Center of Local, State, and Urban Policy, University of Michigan, Gerald R. Ford School of Public Policy, and a research project manager there. First of all, we're seeing people work at home now from the business community on the private sector. Do you think we're going to see some of that in the public sector as well? Will it spill over? Any thoughts?
Well, certainly at the University of Michigan, we've had a huge shift in our own way of working. I would typically be spending lots of time meeting with students, meeting with my colleagues, cross-pollinating ideas across the university, and that has had to all shift online very rapidly. So we've been finding new ways to do that kind of work. Luckily, we tend to, it's relatively easy for us because we are sharing information. And so I think there's a lot of concern among my colleagues whether we'll be back to a regular campus life in the fall or not. It's hard when you have tens of thousands of students on campus all smushed together. So we're watching that and seeing how the continuation of the pandemic is going to affect our work at the university. Other public institutions don't really have as much opportunity to work remotely. I think they will where they can, but for example, right now I'm doing a lot of work with city and township clerks as they prepare for the coming election. And clearly there's an issue of how are we going to hold in-person voting in August and November. Sometimes people forget we have an August primary on the 4th in August, which is just a couple months away.
Right.
And so we've got it's not just November we have to worry about, but that August primary is coming up fast. And our local clerks, while fortunately in 2018, Michigan passed a constitutional amendment saying that we can now vote absentee ballot. Thank goodness that we passed that back in 18, and all of our clerks had a couple of years to gear up for that. But there are still people who are going to want or need to vote in person, or they'll be allowed to. And so figuring that out, it's not going to be all remote, and there's going to be some challenges to local governments to put that into place to make sure that voters are safe and poll workers are safe.
Well, no question about it. And you're right. 2 elections, one in August, one in the fall. We've all heard about this one in the fall almost every day on the news. So we know those are coming up. Just another angle. I don't want to get too deep in the weeds, but that's okay. We get deep in the weeds in this show. I was talking to one of our clerks the other day, and Debbie Binder in West Bloomfield, and she said she's got a whole nother issue because a lot of the election workers have been retired people. And that age group right now, a lot of them, rightfully so, don't want to be in front of the public to the degree that you would have to be in an election. So our municipalities are going to have to train a whole lot of election workers who are going to be working the polls possibly for the first time ever. I know that's not just a concern in her community, it's a concern everywhere. So I mentioned that because I'd like your thoughts on that, but also just as an appeal to anyone listening, if you'd want to, have some fun, especially young people, right? What a great opportunity to get a great lesson in civics, right? To go work an election. So go do it. But I assume that's a problem for a lot of our communities.
Well, and they pay you too. So it's a paying job. Go ahead and get trained. You'll get paid for the training, and you'll get paid for the day that you work in the polls. So it's not bad.
I assume you have to be 18 to do that. But if you didn't,
I believe so.
I would think so. But if you didn't, maybe that would be a great thing for some high school programs to work on. Maybe we can get to work on that. So let's talk about the election. Controversy here in the state. The state has decided to send out absentee ballot registrations to every voter in the state of Michigan. And, clearly the president wasn't too happy with that idea. Is this something that was contemplated back in 2018 when the rules were changed about absentee voting, and any thoughts you have on the matter?
Yeah, I don't think there was any thought that the state would email or would mail out ballot applications. So I want to be clear for everybody understands these are not actual ballots that you would use to vote. This is an application form that you have to send into your local clerk that says that you want an absentee ballot. You sign that so that they can compare that with the signature they have on file for your voter registration, and that's when they send out the actual absentee ballot to you. So you can actually get, in many elections, although the state doesn't do this sending out of application forms, lots of get out the vote operations, campaigns, and different groups will send out these kinds of things. So you may get 4 or 5 of them in the mail in any given election season from different places.
In fact, it's interesting you mentioned
an absentee ballot, right? And so it's not.
Sorry about the delay. It's interesting you mentioned that, though, because I got one of those. I got one in the mail this weekend, and I opened up my mail, and there's this thing about absentee voting, and I thought, oh, this is that mailing from the state of Michigan, but it wasn't. It was from a political organization that must feel my voting is aligned with them, and they wanted to encourage me to go get my absentee ballot.
Exactly. So this is not an uncommon practice at all for get out the vote efforts of all kinds. This is just the first time the state of Michigan has done a blanket version. And I think their concern was that there would be these kinds of efforts. So for example, I live in Birmingham. Birmingham clerk has already sent out one of these to me to let me know that I could get my ballot absentee. And so I filled it out and sent it in because typically I like to go in and vote in person, but I think this year I will be happy to do an absentee ballot. So it's not at all unprecedented. It's just that the state felt that there would be disparities of this kind of effort. So some communities would be, and some voters would get a chance to do this and have that appear in their mailbox. Others wouldn't, and they just wanted to level that playing field a little bit by everybody getting one of these ballot applications in the mail.
And again, without getting into weeds, it's a political thing too, because people will look at it through a different lens depending on whether they have a D in front of their name or an R. So we can just hold on, brace yourself, folks, and for that big debate to happen over the next couple of weeks and months, and we'll all make the best out of that. Go ahead.
I was going to tell you that I actually, one of my, the project that I managed at the University of Michigan is a survey research project where we survey local government officials, including this year, local government, city and township clerks, talking about election security and whether they are concerned about issues of fraud or disinformation or problems with absentee ballot, problems with same-day registration. So I've been hearing a lot from clerks over the past couple months as to what they're concerned about. And fraud does not appear to be a big concern among our local clerks here in Michigan. I think that they feel like they've had absentee ballot and understand how it works for a long time. They understand the change that happened in 2018, and they're gearing up for a big flood and an increase, but they feel like they've got it covered. So I think that we do have to be careful of voter fraud. This is a new world that we're living in with lots of changes. And so we want to make sure that we are diligent about that. But I also think that our clerks, fortunately, we're decentralized enough that the clerks across the state, we have more than 1,000 city and township clerks who are going to be running these elections in their communities. And so I think we're fortunate to have that kind of local oversight over these kinds of matters.
Debra Horner, I agree. I'm a big fan of local control of things like this that are really important, and I also think it's a good idea that we have local clerks that are in control of that. But that's a whole nother issue, this whole thing. It'll be interesting to see how it plays out over the next couple of months, certainly to be a hot spot for political debate. The census, again, if you've been watching your mailbox, the census information has been coming. Hopefully you have seen the paperwork that has come and responded and sent your information back in and are not going to get a knock on your door in a couple of months. But the whole census program, because of the COVID-19 crisis, has been pushed back a little bit because we don't want to have people door knocking during this current situation. I assume the best thing we can all do is respond. It is the law. Respond to the federal government's census requests. What are you seeing on the whole census front, and are you keeping an eye on that?
A little bit. I also have been hearing from local governments about the challenges they've been facing. So obviously the census is run at the federal level with the help of the state and local governments, and typically they would be door knocking. Typically we have thousands of enumerators running around people's neighborhoods, and obviously that's not what we want to do. So again, our state government and our local governments and all of these nonprofit agencies who like to help promote the census have had to shift their gears away from things like library kiosks or door knocking to things like postcards or social media campaigns and things like that. So it's been, I think, a real challenge for them to take all of those preparations that they did during 2019 and kind of throw them out the window and start from scratch with the eruption of the COVID crisis. But one of the things that's really helpful for the first time in 2020 is that people can do the fill out the census online. That was not available in 2010. This is the first time they were able to do that. So people don't even have to get something in the mail. They will, but they can also do their census application or the enumeration online, which is great. I think that's extremely helpful with where we are right now. I think that however, local governments are extremely concerned that because of the discombobulation that people aren't going to fill it out at as high rates as they need to. There's so much tied to census numbers in terms of not only a congressional seat for the state of Michigan is at play, but also things like funding for hospitals and how many ventilators your community has available to it from the national stockpile is based on what the census says is how many people are in your community. So schools, roads, everything we can think about public health is tied to the census numbers. So I think communities have a huge incentive to try to get people out, but boy, they've really been thrown a loop because of the sequestering.
Dr. Debra Horner, she is from the Center for Local, State, and Urban Policy at the University of Michigan, Gerald R. Ford School of Public Policy, a research project manager. Thanks for your thoughts. I found that really informative and interesting. I hope our listeners did as well. Anything else you'd like to add before we say so long?
I do want to put a pitch in. June 1st is the deadline for registering for the new Independent Redistricting Commission. That was also passed as an amendment in 2018. So if any listeners want to get in at the last second, that is also available as an online registration. And then I would encourage people to, as you already mentioned, I was going to put in a pitch for sign up to be a poll worker. It's very simple training. It will be a good day and way to help in the COVID crisis and keep people who otherwise might be vulnerable safe.
Absolutely. And again, that's something that generally a lot of folks from the elder population here in our communities, they serve, but now is not the time for them. So you might enjoy it. I think you would. Yeah, and it is, as you said, it's a paid position. You'll make a couple of bucks anyway. So thank you, Dr. Horner. Good to talk to you.
Thanks for having me on. Take care.
Very nice to be with you today. All right, Tyler, did we get too deep in the weeds?
No, we did not. I think that covered a lot of important topics and did so in a very neutral way.
Well, I didn't mean those weeds. I mean, just like it gets complicated talking about money and all those kind of that stuff. Yes,
yeah,
of course
we went into a lot of detail there.
There is. Well, I hope you found that interesting. And your local municipalities, they have their hands full. Hold on, it's going to be a rough ride because they are going to be very tight. Our schools are going to be tight of money. Our municipalities are going to be tight of money. The state's going to be tight of money, and we have a couple of tough years ahead of us. Even if we optimistically come out of this thing with a V, we are going to have a couple of tough years ahead of us. Could you make these numbers bigger on all these screens? It seems like each week it gets harder and harder to read.
If it's something that's possible, sure.
Actually, we probably could do that now that I joke about it. At the end of every show, when Tyler and I are together, and it's always good to be together, we take an opportunity and go through what is called the COVID-19 vocabulary. And this is a list of items that have come up over the past couple of months doing the show. And we like to share this information with you because it might help you understand what's going on. And also is a good reminder the things that you need to be doing to keep things safe. So Erica Jones is standing by. We can pop in on her at any moment if she is available. I think we're going to go to her first real quick. All right. Hi, Erica. You are live.
Oh, I'm not. Hi.
Hi. Sorry about that.
Here.
I didn't give you much warning. Where are you?
You're good. I'm here at Hirsch's Boutique on the boardwalk on Orchard Lake Road. So we're going to go inside, actually.
Retail is open.
Yeah. Thank you. So, yeah, this is the first day they're open for appointment. right? Appointment only. So do you want to talk to, what's your name? My name is Gerald. Jaffe. Hi. So can you guys tell us a little bit about your reopening and what the plan is for how you're going to adapt to appointment only and everything?
So basically what we're doing is you can give us a call, you can email us, and then we have an app that we've set up so you can schedule your appointment. We have sanitized the store. We've done a major cleaning. We are sanitizing the store between each customer. We've set up 6 feet markers throughout the store, and we've also set up hanging racks so that while you're shopping, you're able to hang things that you might want to try on so that we can keep our 6 feet distance. And that's pretty much it. We're so excited to be open and to have people in the store.
So how's the first day been so far? Have you guys had some people in, or?
Yeah, we have. So far, we've had a customer this morning. We're having a couple more this afternoon, and we're scheduled with appointments through the rest of the week.
All right, yeah, that's awesome. I mean, I know I'm excited to be able to go shopping again, so I'm sure other people are too. So yeah, this is a great opportunity. And you guys are a women's clothing boutique. All right, so yeah, Hirsch's Boutique on Orchard Lake Road. They are open for appointments. And is that Monday to Friday? Awesome. So Monday to Friday, 10 to 2, they are open for appointment. So yeah, make sure to stop by. Thank you guys so much.
Erica, how's it feel to be back in a store again? And do you like to shop?
Yes, love, my favorite thing. So that was great. I'm glad they were so nice and willing to talk. And you can tell these business owners, they're so happy to be in business once again. This was the first store I've honestly really seen that was very open and ready to go. And, when I was talking to the girl, she even said to me, she's like, of course we wanted to, open right away and not miss out on any business. So I'm surprised to see that not all these other local retail shops have been as eager, but, that was really great. And I definitely think people should get out shopping. I know I will soon.
All right, Erica. Well, I appreciate the report. We got to scoot along. We're getting to the end of the broadcast, but thank you very much. And there you go, Tyler. And that, not different than I experienced. People are going to be a little slow to get back into their routines. And, maybe more of the retail will open a little bit later in the day, too. That's possible.
Yeah, it's also possible, and I think that maybe some people are hesitant initially to let these businesses work the kinks out and get used to this new normal they're operating under and make sure that it is 100% ready.
Based on what I saw today and what we've been hearing from everybody, these stores are the cleanest they have ever been. I mean, people are...
They seem very ready.
Yes, if the stores apply to their stores what I've done to my hands have never been so clean ever. They get washed like 20 times a day.
Oh, probably right around that time.
All right, COVID-19 vocabulary, flatten the curve.
Flatten the curve is a concerted effort by the community to reduce the number of cases of COVID-19 to prevent an exponential growth.
And physical distancing.
Physical distancing, keeping at least 6 feet, if not more, away from other people to prevent the spread of COVID-19.
Fomite transmission. That one never really caught on.
And didn't really catch on. It's kind of a deep in the weeds one. It's a situation where you may pick up the virus from a surface or from another person by touch.
The transmission of a virus from an object or person carrying the virus. Happy birthday song.
You've seen that twice over, and you're pretty good to go in terms of washing your hands for at least 20 seconds.
Curbside testing.
Curbside testing, that is quick testing that's done usually through a drive-through setting.
Yeah, we've had curbside everything, curbside retail, but almost all of it is going by the wayside. PPE.
Personal protective equipment, that's face masks, that's face shields, that's gowns for hospital workers.
And contact tracing.
That is getting in contact with people who have been associated with people that have tested positive for COVID-19 so you can track the spread of the virus and who may and where the virus may.
They're doing that up in Traverse City after a couple people from outside the state of Michigan came in with COVID-19. Now they want to see who they encountered, and they are putting everyone, in quarantine for a couple of weeks. Non-dominant hand.
Your non-dominant, that didn't really catch on all too much either. Your non-dominant hand is the opposite hand of what you usually use for writing, for throwing a ball, for opening a door. You want to use that to open doors, to touch objects, because you're less likely to scratch your face with it.
Antibody testing.
That is testing to see if you have cells in your body that are capable of fighting COVID-19.
All right, facial covering displacement.
That is where you put your face mask on your face wrong. It's not covering your nose. It's not going all the way over your chin.
It was too hot over the weekend. I saw a lot of people with facial covering displacement. It just got too hot. And then Megacast.
It's not a regular broadcast, a simulcast, or a podcast. It's a little bit of everything, encompassing local community radio and TV outlets as well.
And that's what we do each and every day. Thank you very much for tuning in. We really appreciate it. Tyler, great job today. Thank you for watching and listening out across our great stations. Thanks to Erica Jones, doing a really good job. Not easy to be out there in the field, but she got all the valuable information from an auto dealership and a retailer back in business as the state continues to open up. Thank you very much for tuning in. Megacast will be here again tomorrow at 10 o'clock.